Isa po ang bansang Israel sa mga nanguna sa buong mundo sa kanilang COVID-19 response. Sa katunayan, isa rin po sila sa mga nanguna sa pag-roll out ng pagbabakuna panlaban po sa virus at ngayon pinag-aaralan na rin po ng Israeli government ito pong pagtuturok ng ika-4 na dose ng COVID-19 vaccine. Alamin natin ang iba pang detalye tungkol dyan mula po kay Israel Ambassador to the Philippines, Ambassador Ilang. Good morning, sir, and welcome to the program.
Good morning. Thank you very much for having me.
Ambassador, what do we know so far about the proposal to administer a fourth dose of vaccine to the vulnerable sector in Israel? Is this already underway or still under consideration?
It's still under consideration. There's going to be another meeting to discuss this on Wednesday this week. There are different opinions, so the Israeli Ministry of Health and there's a special team to analyze this, have not yet decided. As you know, we are executing the boosters, the third dose, the fourth dose is still being considered.
Opo, but Ambassador, some Israeli health experts are saying excessive vaccination may cause immune system fatigue and may do more harm than good. What is the Israeli government's stand on this?
So it's not clear yet what's going to happen. As I said, the experts are analyzing giving the fourth dose. They're not yet decided if they'll do that. We feel until now the indications are that the vaccine each month the level of antibodies is going down, and this is why they have to they're considering the fourth dose again also after the first, second, then after the third, after the booster. Every month the level of antibodies is going down. So the fourth booster is really being seriously considered, but as I said, there are not enough. There's not enough medical evidence on what will happen if we give the fourth booster. So it's still being analyzed, but it seems to me that this might be the direction.
Ambassador, may we know how is the vaccination rate in Israel as of now? How many received their primary doses? And how many already got the booster or third shot?
Yes. The Israeli population is about 9.3 million citizens, less than 10% of the Philippines. Until now, about 6.5 million got the first dose. This includes children from 5 and above. About 6 million got the second dose. And about 4.2 million people have received also the booster. What we are seeing today is actually, I wouldn't say growing hesitancy, but people are not rushing now, especially not the younger generation, is not rushing to get vaccinated, and especially not for the booster. So we have less than 50% who got the booster until now.
Ambassador, do we have data as to how many Filipinos in Israel are already fully vaccinated?
Well, that's easy. All Filipinos in Israel are fully vaccinated. They got including the booster. It is freely available. There is no limitation. It is up to them. And since a lot of them are taking care of elderly people, and elderly people are the most vulnerable one and most protected ones. So to the best of my knowledge, all Filipinos, caregivers, diplomats, and other Filipinos in Israel have been fully vaccinated, and there is no obstacle in receiving their vaccination. Just regarding the Omicron, I would like to emphasize that the situation in Israel is that the numbers are growing. One person has passed away, but he had also some medical preconditions. He was not a healthy person. Today we have 1,118 positive confirmed to Omicron. Out of those, 723 are people who came from abroad who entered Israel. We have another 861 suspicious cases where we believe that it might be Omicron, but we're still doing the sequencing to identify if it is really the Omicron. And for that reason, we have also the protocols in Israel are now being a little bit more strict.
Ambassador, how this one known death alarmed the government, and what other precaution were put in place in response to the Omicron threat, apart from administering a fourth dose?
So I would say the most important one is really considering the fourth dose and increasing the level of the number of people getting the third dose. The one person, as I said, who passed away, he had also other medical conditions, so it is not alarming. However, the numbers are growing, and if the numbers are growing, it means that there will be also more people hospitalized and more people in serious conditions. So for that reason, we have to take precautions, and we are introducing more strict protocols for example, people coming from abroad. Israel is still closed for foreigners, but Israelis who are traveling and coming back are not allowed to travel now to what we call red countries, and about 70 red countries. Those who do come back have to go into a 2-week quarantine. If they're fully vaccinated, they can go into 1-week quarantine, 7 days, together with a PCR test at the beginning as they enter the country, and another PCR after 7 days. We're also strict with the green tag. Anybody who wants to enter into a shop or into shopping malls has to be either vaccinated or tested and a negative test. People who are not vaccinated are able to enter shops that supply essential goods, such as food and pharmacies to buy medicines. So we're introducing more strict regulations now in order to deal with the Omicron.
But Ambassador, what are your thoughts on the restrictions that are currently in place here in the Philippines to prevent the Omicron spread? Is it somehow at par to the ones in place in Israel?
Well, I'm not an expert, so the condition in each country are very different. So I feel that the situation in the Philippines is good. I can see the numbers, which are still which are extremely low, which is very promising. And I see in general the people are obedient, so I feel quite comfortable. But again, I'm not an expert, so I cannot give you an expert advice on how the government here is responding, but it seems that they're also looking on what is happening globally and taking good care of the health situation here in the Philippines.
Ambassador, there were reports that this new surge caused by Omicron variant may once again overwhelm hospitals in Israel. How is the government preparing for the worst?
Well, the Israeli hospitals are well equipped by now and are quite ready to deal with the surge of patients. But again, I think the main challenge is to make sure that they are not overwhelmed and that they are not getting up to more than 100% of the capacity. And this is why we are introducing more strict regulation in order to keep as much as possible the numbers low. But when we see what is happening in other countries and you see the numbers, it seems that this might also be the case in Israel. As I said, we're trying to control the number as much as possible and spread it on a longer time, plus vaccination. Plus, one more thing is much more testing and sequencing. So hopefully with the others will avoid or will make sure that the hospitals can continue to function properly. But they are, as I said, they are fully equipped. The teams are there. Hopefully we will not reach to such a situation.
Ambassador Israel has been one of the forerunners in COVID-19 response, yet the surge of cases still happened because of the Omicron variant. What may be the cause of this surge? Did people relax in following protocols way too soon?
People in general, people are not really, watching and seeing the numbers, and people are worried, and they're expecting the government to do more. I have to add that also in the schools, we have more strict rules. On the other hand, there is a sense of fatigue. It's a global issue. We are living in this pandemic for almost 2 years. So there's also fatigue in the Israeli public, but the leadership is giving very clear and strong messages. The challenge is to balance between closing down the economy or continuing letting the economy run within sort of living with the pandemic. So we are here trying to balance between two extremes in a way, or between the two extremes, and finding the golden way in maintaining the public health, and on the other hand, keeping the economy and society healthy from that aspect.
Ambassador, what can the Philippines possibly learn or pick up from the Omicron surge experience of Israel?
I think both countries were, in a way, that Omicron came in late. Although I think in Israel the numbers are higher. I know the numbers are higher than in the Philippines. So we'll be happy to again share our experiences and also our regulation and how we are dealing with the situation. As we see today, the pandemic is global. We get different challenges and new surprises. If it was the Delta, now it is the Omicron. We have to learn from each other on our protocols, on our efforts, on our practices, and to see what can be adapted locally. Whatever we bring will help the countries to deal with it. So we are working as part of the global community, and it's important to have exchanges between countries. And as I said, Israel and the Philippines have had some exchanges, and I think we should continue that, sharing the experiences.
Ambassador, we would also like to take this opportunity to thank the Israeli government for sending over assistance to the typhoon victims in the south. What more assistance will the embassy and the government provide in the next coming weeks, if any, Ambassador?
So we sent immediate response. We prepared and we immediately responded. We sent some food, hygiene kits, rice, solar panels to create energy, water purification systems to Cebu, to Bohol, and to Shiragao. This was very important for us to show the sympathy and the close relations, and we care about the Philippines and what is happening here. We are now looking how to continue for the longer run. We are going to continue working on the medical side, working with hospitals here in rebuilding some of the medical facilities that were affected, and there are quite a few. We are in discussions with the government here what should be the longer-term response. I have to say that the Israeli embassy is also we're in touch with the Israeli civil society, which has already seen the devastation, and they're also joining the efforts. And already some Israeli NGOs that have started working here, and they will stay here also for the long run. And we are supporting them, and we're doing this in coordination between us as the embassy and the Israeli government and the Israeli NGOs and civil society. So we'll be here to stay.
Lastly, Ambassador, your message, please, to our viewers and to the Filipino people.
Well, we are living in a challenging time. It's a global world, global challenges. We have the COVID-19, the Omicron coming now. On the same time, dealing with the super typhoon Odette. So it is challenging times, but on the other hand, the Filipino people are extremely resilient and happy people and strong. And my message to you, to the Philippine government and Philippine people is that keep the spirit, keep strong. We still might have challenging times in front of us. I hope and pray that next year will be, from that aspect, a better year. Israel is a partner, is a friend of the Philippines. The Israeli people are friends of the Philippine people, and we'll continue with this partnership and friendship, and we'll work together for hopefully a better 2022 for all of us together.
Thank you for joining us today, Israel Ambassador to the Philippines, Ambassador Ilan.
Thank you for having me.